Let's move on now. Minister of Health Dr Zweli Mkhize is expected to tour the VW Volkswagenfield Hospital and Dora Nginza Provincial Hospitals in the Eastern Cape. For more on this, we cross to our reporter Lwando Nomoyi standing by for us. Lwando, welcome to SA Today. Speak to us. It's been a busy day down in the Eastern Cape. I see it is wet behind you, but the Minister of Health is there. That part of the province, or the country rather, has become what we call the epicenter of COVID-19 in the country.
Yes, definitely, Tabiso, as the President has also raised concern last week during his address that the metro, the Nelson Mandela Bay Metro, has become the epicenter in the country with numbers escalating and escalating and escalating. But the Minister of Health, Dr. Zweli Mkhize, along with his delegation, has arrived here since the early mornings, and they were presented with various presentations from district managers from Sarah Baartman district and from the side of the Nelson Mandela Bay Metro, just outlining some of their plans in order to intensify, and avoid this possible second wave. But in the midst of all that, we saw that worker unions as well, they were picketing outside, and it was just chaos. It was as if they were holding them hostage inside, and some of the concerns they were raising is permanent employment, community healthcare workers that have not been employed by the department since the early 90s. So those were some of the concerns that they were raising, and the long-standing issue of PPE, Tabiso, that they do not have sufficient PPEs. But the minister also assured that if in all districts, whether you're a clinic manager, whether you're a hospital CEO, if there's not sufficient PPEs for workers in the workplace, then they should not work, Tabiso.
Here's a question. We've heard that the Eastern Cape, or that part of the country, is at least about 50% contributor to the numbers that we were seeing in the past couple of weeks here in South Africa. We're averaging around 1,000, 2,000, well, just under 2,000 infections of COVID-19. The Eastern Cape, the health MEC there, it must be worrying times for them, in particular, reading at those stats.
Yes, most definitely, Tabiso. It is worrying indeed, and the contribution to this is poor adherence, people not adhering to COVID-19 regulations and not wearing masks in public spaces. So that is some of the concerns, and also social gatherings, the escalation of social gatherings, even the numbers, they do not adhere to the numbers. At a social gathering, you'd see probably like 1,000 people, and you would not see any social distancing. And it's something that Dr. Zweli Mkhize also alluded to, that he saw something that was circulated on social media of such things happening. For instance, the case that happened in Fort Hare, where students till the early hours of the morning they were partying. So they can also transmit this virus to the elderly, which are at risk, who have comorbidities, who are at risk of dying once they contract this particular virus. So the numbers are concerning, and now there needs to be this regulation when it comes to funerals again, when it comes to events that are held indoors, down to retail shops and all that, so that they make sure that they go back to basics and ensure that all safety is observed.
With regards to that, like you're mentioning, we've heard the President, as you said last week, saying, look, let's not drop our guard. With regards to that in the Eastern Cape, you are our man on the streets down there. What is the mood like in the Eastern Cape? Is it COVID-19 pandemic fatigue? People are tired of hearing it. They just want to get on with their lives. In particular, with the December festive season coming, more people are going to be partying. More people are going to be going home to their families. Some they have not seen throughout the year because of lockdown or possibly being wherever. What is the mood on the street?
Definitely, Tabiso, as the festive season is looming closer and closer, various people who, call the Eastern Cape their home will be coming from all the way from Johannesburg, some coming from the Western Cape. So therefore, by that migration coming to this side of the province, that could also be, a contributing factor to the increase in numbers. But however, the mood within the Eastern Cape is that people are trying to adhere. People are trying to adhere to the law and the regulations of COVID-19 by all means necessary. But there are those areas whereby, for instance, in some townships where people will just walk in public spaces without masks, and some shops as well, would let people go inside the shops without wearing a mask or will not be sanitizing them. So that is also a major concern. Therefore, there needs to be this regulation, and they should intensify their fight against COVID-19, especially with the festive season looming, at our holiday destinations around the city,
yes.
Because we know that we'll also be having tourists coming in. So they'll have to also, pull up their socks when it comes to that and make sure that all safety is actually observed.
Lwando, we know that the minister is still in the Eastern Cape. As you said, he held a briefing earlier in the day. He's going to do a bit of a walkabout there with you. What is he looking at? What should we expect from the minister when he does that?
No, most definitely, Tabi. So, the concern being also, the shortage of beds, the oxygenation, the ventilation. But the minister has assured that all those are actually in place within the metro. There are sufficient beds, there is enough oxygen, there is enough ventilators. But the issue is that there is staff exhaustion. A lot of staff, have succumbed to COVID-19. Some of them have migrated out of the province due to getting, let's say, another job somewhere else. So, therefore, there is that exhaustion within the staff. So I'm sure during his walkabout he will also see and monitor the capacity of staff within these hospitals, whether it's Dora, Nginza or it's Livingstone Hospital, to ensure that and to actually check that they are indeed compliant and they have the necessary resources they need to fight this pandemic.
Lwando Nomoyi, thank you very much indeed for joining us right here on SA Today. We'll come back to you as soon as the minister arrives there for that walkabout, and hopefully you can take us through what she sees and what the concerns are on the ground when the minister is there touring those facilities. Lwando Nomoyi is coming to us live from Port Elizabeth. Let me just give you a quick rundown of what Lwando was speaking about there. As far as the minister is concerned, you had that press briefing earlier. According to the breakdown of the figures now, the number of positive cases in the Nelson Mandela Bay has increased by hundreds of new cases each day. 2 weeks ago, the cases were soaring at around 900 per day. Now, the minister also said nationally the cumulative number of patients testing positive of COVID-19 had obviously surpassed the 750,000 mark with a recovery rate of 92. Now, this is where the problem is. A lot of people saying 92%, well, I will recover. The problem is with that is that if you're not part of the recovery stats, those numbers, maybe your immune system is not as stronger than Tabi Source, for example, you are in danger of actually passing away to COVID-19. So that's what a lot of people have been taking for granted, saying the likelihood of me recovering is very good. Now, the minister did give assurances, as you heard Lwando say, that we never ran out of hospital beds. Of course, that was at the peak of COVID-19 in the country. We never ran out of oxygen or ventilators. In fact, I'm quoting him here, says most of the ventilators were not used. We made adequate provisions. With that said, the minister did say, though, people should also continue doing what they have been asked to do. Wear your masks and sanitize when you leave home, and also be careful. Once again, we'll come back to Lwando as soon as the minister does his walkabout. Let's give you